Remember, when you visit an eye specialist, the clinician aims to check the overall health of your eyes. That is, the structure of your eyes, both outwards and inwards, if they are functioning well for you to have a clear vision. Hello everyone, welcome to my YouTube channel. It's your eye doctor back again with eye care tips to ensure that you have healthy lifestyle for a better vision. If this is the first time you're watching my videos, my name is Kemunto, a cataract surgeon based here in Kenya. Kindly hit that subscribe button and also hit on the notification bell so that every time I upload a new video, you get notified. Thank you for your support. Can I ask you a question? Have you ever had irritation in your eyes that bothered you a little and then disappeared without any treatment? I know many of us have gone through that. Do you ever imagine that that could be a signal to see an eye specialist? Let's not answer that question because it has happened to so many of us. But today I have 13 eye signals to see an eye specialist. So my dear viewer, have a seat, take a book, take a pen, and let's learn. Number 1, eyelid twitching or excessive blinking. Blinking is very good and healthy for your eyes. I have a lovely video discussing about excessive blinking. If you have not yet watched, kindly check it out. Very informative. Excessive blinking can be a concern and very annoying. There are several factors that can trigger it. Kindly watch out that video. It explains so many triggers that can cause excessive blinking, and that it's a trigger to see an eye specialist. Yes, because sometimes this blinking can be a sign of a serious condition. Most of the time, it can resolve by itself. But other times, it requires an examination by an eye specialist for proper management. And number 2, white spots on your cornea. Cornea is the anterior part of the eye, which is colorless. It allows light to pass through for a clear vision. When you notice a spot on this part of the eye, it's a sign of infection or abrasion caused by a scratch or trauma. People who use contact lenses are at a higher risk of developing spot on the cornea. And also this spot on the cornea is very important to be examined by an eye specialist. Number 3, blurring of vision. This is not normal. It's an indication of a medical condition, for example, diabetes. If the blood sugar level is not well controlled, it can present with blurring of vision. Hypertension, when the blood pressure is not well controlled, can also present with blurring of vision. Some cancers can also present with blurring of vision, like brain tumors, to mention a few. All these can present with blurring of vision, which is a trigger to see an eye specialist. Studies also indicate that blurring of vision comes from 73% of diabetic patients. But also it can be due to eye conditions. For instance, to mention a few, cataracts, dry eyes, even refractive errors if they are not well corrected with prescribed glasses. Uncontrolled blood sugars or blood pressure can affect the back of your eyes, causing a disease called diabetic retinopathy and even hypertensive retinopathy. So, it is very important when you have blurring of vision to make an appointment to see an eye specialist, especially if you have these conditions like diabetes and hypertension. When you visit an eye specialist and you are diabetic or hypertensive, we usually check the back of your eyes to check the retina if the sugar or the blood pressure has affected your eyes. Even when you go to another extent of dilating your eyes, we put drops inside your eyes to open the pupil widely so that we can check all the parts of the retina to see if there are any changes caused by uncontrolled blood sugars and uncontrolled blood pressure. So when you have blurred vision, it is a signal to make an appointment to see an eye specialist. 4, excessive rubbing of your eyes. It is not healthy to excessively rub your eyes. This is an indication of an underlying condition. Yes, e.g. allergies that usually cause allergic conjunctivitis, especially in children and even to some adults. Allergic conjunctivitis is an inflammation of the conjunctiva, and there are some medications that are usually put to reduce that irritation that can cause inflammation. Allergies are caused by allergens in our environment like dust, smoke, sprays, pollen, and even animal furs that come from our lovely pets. But by avoiding these allergens, you avoid irritations that trigger the itching. Dry eyes can also cause excessive rubbing. By adequate production of tears, usually it soothes the eyes, cleanses it, and prevents the irritation that causes you to itch. But when the eyes are not producing enough tears, they become dry, leading to irritation and a feeling of rubbing. There are lubricants we prescribe for dry eye syndrome to soothe the eyes and also to prevent that feeling of rubbing and itching all the time, because rubbing the eyes is not good. And once you experience excessive rubbing, see an eye specialist. Number 5, seeing floaters. What are these floaters? These are spots in the line of your vision. They usually appear like black or gray specks, strings, cobweb-like, or even flying insects that floats in the line of your vision. When your eye moves, you see like there's something on the line of your vision. Some people even try to catch it. They feel like it's a fly. They try to catch it and they are not catching anything. It's so annoying. At the back of your eye, there is a gel called vitreous that contains water, collagen, and hyaluronic acid. As we age, the protein fibers that make up the vitreous usually shrinks down to little threads that usually clamps together and cast shadows to our retina. Sometimes the floaters can be accompanied by a flash. You see a flash of light in the line of your vision. It's because the vitreous has pulled away from the retina, a condition we call posterior vitreous detachment. But not to scare you, most of eye floaters do not need medical treatment, but rather to be monitored closely. In case you experience these floaters and flashes, kindly come for eye examination, because it's never a serious condition if there is no damage at the back of your eyes. It's advisable to come for checkup to rule out the cause, since other serious conditions can present with floaters, but I don't want to scare you. Just come and check your eyes. Let the clinician examine the back of your eyes and ensure that everything is okay. And then you'll be reassured and you'll be able to live with your floaters, because as you get along, you'll get used to it and even sometimes it goes away. So whenever you experience floaters, is a signal to come for an eye examination. And number 6, eye pain. Infrequent or mild pain is typically no reason to panic, but if it becomes intense or ongoing, is a signal to see an eye specialist. It could be caused by just an eye infection or a warning sign to more serious condition. Especially eye pain that is accompanied by vision loss can be a sign of an eye emergency. Kindly see an eye specialist for evaluation if you begin to lose your vision while experiencing pain. It's a signal. And point number 7, foreign body sensation. This can be a sign of many conditions. To mention a few: dry eyes. You normally feel a gritty sensation. It's like there's sand inside your eyes. Allergic conjunctivitis. You will feel like there's sand inside your eyes, and it's because of the inflammation. Corneal abrasions, corneal lacerations, even corneal ulcers, and also eyelid infections. All those can cause a feeling of a foreign body inside your eyes. You can also feel like something is inside your eyes and there is nothing inside your eyes. It's just an inflammation which needs to be checked properly by an eye specialist. So checkup is the only way to see whether you have any damage inside your eyes. And number 8, eye fatigue. This usually affects so many people who use digital devices too often. And nowadays, that is the common thing. that we normally use. You're either using your computers, you're either using your phones, you're either watching your TV, movies, series. So you find most of the time you're on these digital devices. We advise 20-20-20 rule. That is, for every 20 minutes, look at a distance of 20 meters away from you for 20 seconds. If you practice this, still there is fatigue, come for eye examination. And number 9, light sensitivity, also known as photophobia medically. It's usually inability to tolerate light. Someone who is sensitive to light, any source of light like sunlight, fluorescent light, or even light that comes from the digital devices, experiences eye discomfort. Some, they are wearing the protective blue blocks, but still they feel the light is too sensitive to their eyes. Come for examination. And when you do know that you're sensitive, it's when you suddenly have discomforts that was never there before. You start just experiencing the discomfort, and yet you're practicing the 20-20 rule, you're wearing the blue blocks, and yet there is still the sensitivity. Come for examination. There could be other things that are happening in your eyes. I see in the clinic, people come with symptoms like tearing, excessive blinking, eye pain, headaches, and even blurring of vision, to mention a few. To some people, there is discomforts that are usually very extreme, that even reduces their vision. Some even squint. Some even close their eyes completely when they face the lights, which is very abnormal. And this is not normal. It's not normal at all. Come, be checked. And number 10, double vision. This is when you see 2 images instead of 1. This can be an indication of a systemic disorder, or maybe your eye muscles or your eye nerves have an issue. Double vision can disrupt a person's balance, movement, or even reading abilities, so you will not even perform at work. Several causes can cause this, and it is not normal. So kindly, if you have double vision or you're seeing blurry, like there are 2 images in 1, please come for examination. And what can cause this double vision? To mention a few: strabismus or lazy eye, that is crossed eyes. When your eyes looks in the other direction. Have you seen those people? The eyes are facing in a different direction when they are facing ahead. That one can cause double vision. Another condition is like papilloedema. This is inflammation, like a pressure from the brain towards the optic nerve. It's a disorder. Come for evaluation. Let me not scare you. Please come when you have double vision. Number 11, not able to see at a distance or near. If you're finding yourself squinting to read road signs or even adverts, my dear viewer, come for examination. Like our citizens, older citizens who are 40 years and above, they usually hold a book at a distance of an arm's length. You find someone is reading like this, or even squinting their eyes while reading. Please come for examination. We normally help you with reading glasses. And you will read comfortable. Your newspapers, even your payslips, you will be able to read very comfortably. Those 2 tiny prints, you will see them very clearly. Come and let your eyes be checked. If you already have prescribed glasses and you still have those problems of reading the road signs or even adverts or reading the near prints, and you have glasses already, please come and check those glasses. Maybe you need to change the lenses because it is the time, because it has reached a time for you to update. And point number 12, frequent headaches. Headache that is associated with the eyes mostly does not present with nausea and vomiting. It occurs when you focus on something for too long, e.g., watching your favorite channels, reading long distance, or like adverts when you're driving, or even when you're driving, you're not able to see your side mirrors. Please come for examination. This type of headaches mostly occurs on the frontal part of your eyes, or even at the sides of your eyes, where the nerves and the muscles are located. So, when you're reading and you have those headaches that are forehead and at the sides, it's because you're straining those nerves and muscles, and then they start to ache, and then you start experiencing the headache. Please come. Don't take painkillers. Come fast for examination. Halos. What are halos? These are bright, colorful circles that usually appear around lights. They are mostly often noticed when you're driving, especially at night. You see on the street lights or headlights. You see like colorful lights around the street lights and the headlights. Those are halos. And it's usually very clearly when you're driving. This can be an indication of a serious eye condition, especially if it's accompanied by pain, blurring of vision, and other symptoms, maybe headache, or even you're feeling dizzy. Please come for examination. Trouble seeing at night, very common. We experience this at the clinic. In medical terms, we normally call this nyctalopia. It is difficulty to see well at night or in poor light. It is not a disease, but rather a symptom of another problem. There are so many causes that can lead to this, e.g., nearsightedness, some medication, some deficiency or vitamins like vitamin A, some conditions, eye conditions like cataracts, or even at the back of your eye conditions like that affect the retina. To mention a few, those ones can make you not to have a clear vision at night. So come for examination. It's a signal to see an eye specialist. So when you come to the eye care center, we normally take a good history to be able to know why you're not able to see at night. We also do a very good examination. We check the anterior chamber and we also check the back of your eye properly so that we can know the cause of why you're not seeing at night. Number 15, sudden loss of sight. There's some people who can have sudden loss of sight. This is when you find it difficult to see. By sudden loss of sight, I mean you might experience sudden blurry vision, sudden loss of peripheral vision. Maybe you are driving and then you notice you're not able to see the side mirrors. That is sudden loss of vision. And also, you can be able to have loss of vision at the central part of your vision, where you see a dark cloudy shade along the line of your vision. That one is a signal to come for an eye checkup. There is a chance that it can lead to a sudden blindness, even permanent blindness, if it is not treated early enough. Let me not scare you. As long as your vision is not the way it used to be, come for an eye checkup. Periodic eye examination will identify some eye diseases that do not present with symptoms so that they are treated early to prevent blindness. For instance, some cases like cataract, they usually affect your vision. Eye diseases that do not present with eye symptoms are like glaucoma. When it's early diagnosed and treated, usually it has better outcome. Getting this information is of high importance because it will enable you to book an appointment with an eye specialist early enough to ensure speedy treatment. So my dear viewer, I welcome you to M&E Eye Care Center, which is located at Ongata Rongai along Magadi Road. At the Time Suites building, come to first floor, room 112. We have ophthalmology consultation where we focus on comprehensive eye examination. We also screen eye diseases and offer proper management through ophthalmology and cataract surgery. We also have an optical unit for refraction and we dispense frames and lenses. We also screen for diabetes and hypertension because these two diseases usually goes hand in hand with the eyes. So please come for your annual eye examination. The clinicians are ready and so welcoming to be able to examine your eyes, to check the back of your eyes, to check your glasses if they are ready to be changed, or we also advise you whether the glasses are okay. And we also give you eye care tips. So my dear viewer, come and let your eyes be checked. We care for your eyes, and our motto is healthy eyes first for a better vision. Thank you so much for being here. I appreciate you so much. I hope you got something out of these eye care tips, because the eyes are very, very, very important parts of our body. Until we meet next time, bye!